Mental health professionals. I'm talking to counselors, social workers, psychologists, psychiatrists, even educators and teachers or pastors, anyone who's working in a helping profession in mental health space. I know right now that so many of us are in a place where we just have felt like, I can't do this anymore. I'm done. I can't do it. You're feeling like you need a place for some restoration, some renewal. You need a reset. And I've got a reset to tell you about today. So hold on, we'll be right back.
Welcome to the Multicultural Mindset broadcast. Your host is Dr. LaVerne Collins, a licensed professional counselor, award-winning trainer, and keynote speaker. Dr. Collins is the author of Overlooked: Counselor Insights for the Unspoken Issues in Black American Life. Dr. Collins has also been a featured monthly columnist in the American Counseling Association's Counseling Today magazine with her Honoring Diversity column. Now, here's Dr. Collins.
I have as my special guest today Victoria Suazo, and she is the lead owner and CEO, Chief Encouragement Officer, right, Victoria?
Yeah.
At Victorious Living Counseling, serving the Atlanta, Georgia metro area. Victoria, thank you for being. Um, I'm not going to call you a guest. We're going to just have a dialogue today about the need for reset and the program that's coming up. But thank you for joining me today.
Absolutely, Dr. Collins. Thank you for having me.
Yeah, Victoria is working with me on what I said in the opening. We need a reset.
Yes.
And New Seasons this year, you may not know, is actually celebrating our 15th anniversary as a practice. And we want to do something to give back. Yeah, we want to give something back to the professional community. So we are launching a weekend reset. And I'm just going to give like an overview, and then we're just going to talk about it. Our dialogue will let you know what's happening with this, because we are over the moon, over the hill, over the sun, everything excited. But the weight of the work is the theme of this event. And we recognize that the weight of serving people who are stressed out, burned out, unemployed unexpectedly, the weight of carrying the burden of people who live or have come from survival-oriented communities, however, whatever that may mean, that weight right now is so heavy, it's oppressive. And yet, every day, if you're a helping professional, you're opening up your door and your heart to hear those stories. That's weighty, but that's not the only weight of the work. The weight of the work is that at the same time, we're trying to take care of ourselves, our lives, our families, our emotions, our financial instability, all of our questions and uncertainties. That creates a double weight. The weight of this work right now is probably heavier than it's ever been before. So we've got something special where we want to help you reset. So Victoria, tell us about this reset weekend.
This reset weekend. So I love, Dr. Collins, how you have already started getting us as some of your, I guess, we're dream team, getting our minds ready for what this really is, because it's not just another conference. It really is a chance to think deeply about the work that we're doing, that work that we continue to do, and how we as clinicians need to attune to ourselves and help ourselves so we can show up to better help serve our clients. I think just from looking at your list, so just for everyone listening, the lineup for the training knockout, right? All the different aspects of how you all are about to be poured into and educated and reminded of the importance of our work, and also the value that we bring as counselors to the world. It's just amazing. I don't think that there are really words that I have to describe it, but I can definitely say that from the 3 days. So it's a 3-day reset. And every day of the reset, we do have a pretty heavy hitter, if I could just say it very plainly, in the counseling world that
Yeah,
will be
let's talk
present.
about who we have coming. This is a
Yeah,
it
we have.
is it's a dream team of a lineup.
Right. I mean, it was pretty much the who's who. I think it's multicultural counseling, if we're being honest. David Archer, a lot of people know him as
Anti-racist
right,
psychotherapy is his book.
anti-psychotherapy and then decolonizing EMDR. I am an EMDR trained and certified clinician, so I'm a big fan of David Archer. We also have past ACA president,
Dr. Kent
right,
Butler.
Dr. Kent.
Yes.
I've met
Yes,
him in
yes.
person. I hope he doesn't see that and get offended that I tripped over his name. I know exactly who you are, Dr. Butler. I remember meeting him at a conference. We also have Dr. Norma Day-Vines, who is famous for her work
Yes.
broaching.
Broaching. You know, she has been in that. She's been talking about broaching for over 20 years. And now she has actually written not just more journal articles summarizing her research, but she has actually written a book that's coming out this fall.
Mhm.
So she's going to be there and you'll be able to, order her book, but you'll really hear from the person who coined that term as being so meaningful and relevant in our field, what it means to broach content that is related to ethnicity, race, or culture. That
Mhm.
she's phenomenal. She's phenomenal. And we have Dr. Portia Lockett.
Portia Lockett, that's right.
Dr.
Yes.
Portia
So
Lockett out
a
of
fantastic
Detroit.
lineup.
Yeah,
Fantastic lineup.
yeah, absolutely, absolutely. And I'll be speaking as well. And what our desire is to bring to you the most recent researched information from the research hall, so to speak, of academia, giving it to you to help you be most effective in working with people of diverse populations. But that's not all. And this is Dr. Portia Lockett's specialty. We want to talk about what it means to be strong and yet vulnerable, what it means to feel like you're at the end of your rope and find a way to keep going without sacrificing yourself. I
Hmm.
believe that, and I've said this before, that we've all gone through things and we try to be strong. But even for us, strength without healing is just survival. And we need poured into. We need to sit at the feet of people who have been doing this for the long haul, for
Mhm.
the people who are the thought leaders and influencers. And Dr. Portia Lockett is one of those. Her specialization is in resilience and self-care and healthy strength,
Mhm.
healthy strength, not just that push through, push, what we, how we do, right?
Yeah, like the
Um,
toxic
the,
hustle culture that I think is really common
yes,
now. Just grind, grind day and night, get no rest,
yes,
whatever.
yes, yes.
Mhm.
We're living in a hustle culture, and that affects us because we feel like we've got to hustle, we've got to do more, and this person needs this, and that person needs the other.
Right.
Hey, you know
Benefit
what?
from that.
Right. So we're addressing the weight of the work from both sides, the weight that's on you as a professional and the weight that you carry personally as well. So great lineup. Dr. Norma Day-Vines, Dr. S. Kent Butler, David Archer, Dr. Portia Lockett, and myself. It's a dream team.
You guys don't want to miss this. This absolutely is
Don't want to miss it.
probably
And
once have they all ever been in one setting before like this? Like one
I don't
education
know. That's a good
facility? Yeah,
question, but
this might be the
yeah.
first time. Hmm.
Yeah, and this, by the way, we didn't say this. You don't have to travel to attend this. This is virtual.
This is
August 20th, 21st, and 22nd. It's
mhm.
virtual. Now, let me add to that. This is a 15 continuing education hours package. So, over the course of these 3 days, 15 continuing education hours, and five of those can be ethics if you choose. So, as we approach the fall, for those of you who have renewals coming up, well, everybody has a renewal coming up sometime, whether it's this fall,
Right.
next spring, next fall, whatever, you need hours for a licensure or you need hours for, your NCC. So these are NBCC approved hours, and we're going to make sure that there's coverage for the social worker hours as well. You need it, we got it, and the price is right.
And you don't have to leave your house.
You don't
So
have to leave the house.
there's really, if this is a win-win, you can do this all from the comfort of your home. You don't have to worry about paying for travel, paying for lodging. You can get these CEs. And I know Georgia, our deadline is September 30th. So you really can get them in before that deadline hits.
Yeah, yeah. You can sit at home with a popcorn or a bowl of ice cream or whatever you want, or something healthier. Make it a salad, whatever.
Smoothie, acai bowl, whatever you want.
But write those dates down: August 20th, 21st, and 22nd. Now, talk a little bit more, Victoria, about the weight of the work and I opened it with it a little bit, but why do we at New Seasons believe it's so important to call this out right now? Why at all, and why now? Let's talk about that. What are your thoughts?
So I definitely want to just start off by saying that this isn't just something that I heard and think it sounds good, but that I've lived, right? So I've been a burnt out therapist before. I've questioned if I can keep going, if I can continue carrying what my clients are carrying, and then also living my life as a woman of color with the climate that we have going on right now. I don't think anyone is unaware. If you are, let's
We
get
don't know
get up to
how that
date,
happened.
right, on what's going on in the world right now. But it's just so important to address signs and symptoms of burnout. It's so important to really acknowledge, check on yourself, counselor,
Mm-hmm.
right? Counselor, know
Mm-hmm.
thyself and be very
Mm-hmm.
aware of how you are carrying the weight.
Mm-hmm.
Otherwise, the weight will make itself apparent in other ways, right?
Mm.
That looks like wanting to do something else or just
Yep.
questioning, do I really belong in this field? Can I
Yep.
really do this work?
Yep.
Questions I've had before, right?
Yeah.
I think right before I met you, Dr. Collins, I was at that crossroads of,
Mm.
man, I love this work, but I don't really know if this work loves me because the way that I'm
Mm.
feeling, it's been it can be hard. It can be hard to do this work and then not have the adequate tools to help yourself process how you as a clinician are feeling, how you are coping, right? All the things that we
Mm.
do and hold space for our clients
Mm-hmm.
it-
Yeah.
in the therapy room. If we're not doing that for ourselves, then we're actually doing them a disservice.
And what about those times when what's what you're hearing from the proverbial couch, so to speak, is really a reflection of what's going on in your own life, your own mind, your own heart? There's a mirror there.
There's a mirror.
And if we're not careful, I mean, we already know about transference and countertransference, but if we're not careful there, if we're depleted, we don't have really the energy stored up to even bracket in the moment and separate ourselves from what the other person is saying. So we got to talk about that. And we got to talk about ethics as it relates to self-care and ethics as it relates to caring for those in our practice communities as well. I'm going to be doing some of the ethics, and you're going to be doing some of the ethics presentations too.
Absolutely. Spoiler alert, I will be doing a presentation on countertransference and how to manage it. Don't want to miss it. But
I
these are
knew I
important
was putting that plug
conversations.
in there for you. Yeah, yeah,
These
yeah.
are these are important conversations that we need to have,
Really,
Dr. Collins, as clinicians.
they
And I
really
think
are.
even when we talk about ethics, it's not even a suggestion anymore. It's an ethical mandate that we as clinicians, and I think especially as clinicians of color, that we
Mhm.
take care of ourselves, that we reset, right? That we're intentional about getting continuing
Absolutely.
education that, and I think your multicultural masterclass does a great job of this, but that actually looks for researchers that look like us and teaches and helps disseminate these numbers and this knowledge back to us, because if we're
Yeah.
not careful, we're we're missing ourselves, right? We're overlooked. And I think you're the perfect person to talk about that.
Yeah, we are we're overlooking our own needs. And we are by profession We're caring people. By nature, we're caring people and we're looking out for everybody else. But if you're not looking out for yourself, here's the thing. I've heard that a gazillion times, haven't you, Victoria?
Yeah.
Take care of yourself first. Every therapist needs a therapist. Look out for yourself, pay yourself first. And we get all these admonishments to put ourselves first and to not neglect our own self care. But how many conferences and events that you go to for continuing education balance the need to care for yourself and the need to care for your practice community members so that you get both sides of that care, that weight included in one learning experience? I've never.
Me neither. Me
I've
neither.
never.
Me neither.
So I think it's important, especially as you said, right now, there's so much going on, and so many Black and Brown women have lost jobs that should have had much promise in the DEI space. So many people in education, educational cutbacks. I work with people who work in the education systems, and because of funding being reduced for certain programs and different things, the last thing we needed was fewer teachers in public schools. That's the last thing we
That's
needed.
right. Yeah.
Right,
That,
right. So a lot of teachers are affected by this. Um, Pastors, you're affected because you're sometimes the first person that an individual calls when they face a crisis. And that part's not new. Counselors, we're relatively new on the scene. This is a fairly new profession,
mhm,
the past, what, 50 or so years or so.
mhm.
Pastors, y'all have been doing this all along. But at the same time, I know how high the rate of burnout is amongst pastors. We don't need good men and women pastors, ministers, evangelists, teachers, whatever the specific role you have in ministry. We don't need burnout there either. We need you strong.
Mhm.
So this reset, even if you can't use the continuing education hours, come and glean, join in and glean the information about mental health with survival oriented communities, whether they be racial, ethnic, cultural, ability status, military status, or any other kind of status. We're gonna talk about all of that, the weight of carrying that. We need all of you right now in good health, and we need all of you armed with current information that's going to help you in the ways that you serve.
Mhm. Absolutely.
Yeah.
Absolutely. Absolutely. Very
Uh,
well put, Dr. Collins. I'm excited to be a part of this.
Oh, I am excited to have you and the others on the committee working on this. And I tell you, it's a blessing to me. This is just a personal note because I tend to be that Lone Ranger kind of person, do it all myself. That doesn't work. I thank goodness Lord is helping me grow out of that. And I've got this amazing committee that's helping me. They are a dream, and they have helped me put together a dream team lineup as well. Now, here's the other thing I didn't say. Victoria mentioned that she's going to be doing a session, but she's not the only person beyond those nationally known or recognized voices that are going to be heard. I have uh, my mentees who I have trained through the Multicultural Masterclass. Let me tell you, these are your emerging leaders. These are your new voices in the field. And they are going to have sessions for 1 hour, 90 minutes, where they are training on some of these topics as well. What a gift to hear from the established historic voices, the influencers of yesterday and today, alongside the emerging voices of the influencers of today and tomorrow. My goodness. Can you tell? Can you tell we're excited?
Yeah. Dr. Collins, this truly is. I think this is a very novel idea. I don't think that anyone has ever done what you're about to do. And I'm
Uh,
excited.
I'm
I'm very
excited
excited.
too. I'm excited too. Well, if you know someone who has done it, have them give me a call because I need to learn some things because I feel like a pioneer here in this endeavor. But no, you know what? That's the other thing too. There are so many people doing good work in the communities. Unsung heroes, I call them,
Yeah,
who
yeah,
are doing good work as educators, as counselors, as advocates. And we're going to recognize them because I am not the first for sure. Tell us, Victoria, tell the audience about how we are inviting people to submit nominations for folks to be honored for their work.
absolutely. And I think this kind of ties back into what we were talking about earlier in terms of counselors getting burnt out, counselors, just all types of feelings of discouragement in the field. And I know a lot of times that can come from not feeling seen and not feeling appreciated. And not that any of us get into this work, hopefully not, hopefully not to, get validation or to be seen. But it does help. I think it does help when you are recognized for the
Yes.
work that you're doing. Because a lot of the work that we do is thankless. A lot of the work that we do, we don't get reimbursed by insurance companies if you take insurance, for the amount of time we spend researching for our clients or practicing a modality or
Exactly.
even preparing for our sessions, right?
The
Or if you're
trainings that you go to learn new things.
exactly. Exactly. There's just a lot. There's so much that the weight, right? The weight of the work that goes
Right.
into the work that we do to be competent clinicians that can
Yes.
provide excellent care for our
Yes.
communities.
Yes.
And that's why I'm so excited because in honor, Dr. Collins, of New Season's 15 years of being a practice, being a company, I'll call you, I'll call it a company. Um, you are honoring clinicians, mental health clinicians, and there's three categories. So there's the cultural impact clinician, and that is honoring a clinician who does outstanding work with their practice. Of course, a mental health clinician that lives and I think actually embodies what it means to be multiculturally aware and
Culturally grounded and
multi-grounded in their practice. We're also honoring a community advocate, and this is a clinician who goes above and beyond with how they serve their community. Okay, we're not just talking, I offer a sliding scale here and there, or I offer some pro bono sessions. Hopefully, I do think that all of us should be doing something, of that nature. According to our code of
Mhm.
ethics, we should be.
Yeah.
But the community advocates actually doing some pretty, use your word, pioneering stuff. They're doing some groundbreaking stuff. The nominees I've seen so far that have come through are really like, wow. There are some counselors that are really doing some outstanding
Yeah.
work, starting
And
nonprofits, just all
there
the
you go.
starting
Yeah.
therapy funds. Like it really blows my
Yes.
mind to see this
Yes.
growth.
Yes. And it doesn't have to be a national advocacy
Mhm.
kind of
Mhm.
range or exposure or a national space. People are doing amazing work in in their cities and communities, in their state, regional work, local work. People are doing some things to keep mental health services going, to break stigma, to provide, like you said, free or discounted services, to go into places where there has been justifiable mistrust
Mhm.
and begin to work on building trust.
Absolutely.
All those things count. All those things are advocacy efforts. So we want to see you. We want to recognize you. What else do we have with the awards?
We also have the Transformative Educator Award. So this is going out to a counselor educator that once again is making waves, is going above and beyond in their impact and the way that they are stewarding their knowledge in the field of counselor education.
Now, I'm thinking about how an educator might qualify for this kind of an award. An educator might qualify for this kind of award by providing mental health education in communities, in classrooms, um, at the university level, at other levels. We have school counselors, we have educators, we have school administrators, even
Mhm.
who can, in their own way, and who are in their own way standing up against systemic bias within education and providing mental health education within the various spaces where they work. There's so many ways. So don't think that you need to be limited to a certain title or a certain role or anything to be a part of this. If you work in a school and this is what you're doing, guess what? You can nominate yourself. You don't even have to have someone else nominate you. And that goes for all three categories, doesn't it, Victoria?
Yes, yes, yes. And we encourage self-nominations because we realize that usually the people that are out doing the work, they're not being seen all the time because they're out doing the work, right? So if
Right.
you're listening to this and you know that you've been doing the work and you want to put your name in the ring, please, please.
Yes.
We we
Yes.
we
Submit
respect
them.
that.
Yeah, absolutely. Submit the name of a colleague, a director, manager, supervisor, a friend who you know is doing phenomenal work in any of these spaces. This is the time to raise up our unsung heroes doing this work, carrying this weight. And we're going to announce all of those winners at this is called the Cultural and Clinical Decision Making Reset. So it's a reset experience. And like Victoria said, this is not a conference, a symposium, it's not a think tank. This is an experience, a resetting experience. Academically, I'll just add this academically, we all need a reset. Um, Unless we came out of a school that had a very, like a HBCU or a school that had a very attuned and culturally grounded program. And even then, we've got to put things on pause sometimes and just reset. But unless you have, it's really been drilled into you to stay mindful of the cultural nuances so that you stay culturally responsive, we all need a reset because every year, I've been in this field for 30 years. Every year, every month, I find something that I go, you know what? That represents the system and not my people. I mean,
Mhm.
almost like I said, every week, every month, every year, I'm learning more and more about colonized frameworks that aren't working. And part of the burden, part of the weight of the work is that we're trying to make something work that was never intended for the people that we serve. If our practice communities consist of anybody who is from a marginalized, racialized, or otherized community, we're using tools that were not normed for us, and we're using methods that are designed in many cases, they're used against us, they're used to benefit the system and not the person. So we're going to reset all of that. I believe that the culturally grounded reset will contribute to your personal reset because it's going to take some of the weight off. Like, oh,
Absolutely.
finally, someone who gets it, who understands what it's like
Mhm.
when people come and you know that their burdens, their problems are largely from systems that have failed them.
Yeah.
And you don't,
Systemic.
yeah, it's systemic. And you don't tell someone who's been um, abused by another individual, a domestic partner or someone, you don't tell them, well, think differently about it. Well, people are being abused by the systems that are supposed to serve them. And if we're doing the wrong kind of therapy, you'll tell them to think differently about it. Yeah, we got to think differently about it, but not because the problem is with the way I think.
Right, exactly. Yeah, not because I have faulty thinking as opposed to.
Exactly.
Mhm.
Exactly. That alone is freeing, isn't it? It wasn't, I mean, for me,
Absolutely.
it was freeing to begin to get that understanding. It's okay. It's okay to say that the system didn't work for you, didn't support you. It's okay to say that the
Mhm.
system blamed you. It's okay to even tell elementary school kids or high schoolers the system hasn't served you well, has it? It's okay to say that. It's okay to say to a child, um, does it feel like sometimes you get punished more harshly than kids who aren't black or brown in your
Mhm.
class? Does it feel like the teachers don't listen to you as well, or that you get disciplined more? Does it ever feel like that? I've heard stories of children breaking down because, as I say breaking down, I don't mean in a negative way, but letting the tears flow for the first time because someone validated
Someone
their
acknowledged.
experience.
Mhm.
I've heard I heard I was in a workshop once or something. I was teaching a class, I had a guest speaker, and the one of my students said, what does it look like when a child tries to advocate for themselves in a school setting? She meant, how does a child advocate for oneself in a school
Mhm.
setting? But the answer came from the presenter in terms of how it is judged by the school system. It's judged as, he said, conduct disorder, oppositional defiance, when a child is just trying to advocate for themselves. So in schools, we have people who are advocating against all of that judging and blaming, and who are advocating for school systems to take more responsibility for how they place children in special needs classes or disability categories, how they manage discipline. Yeah, and if you or you know someone who is doing that kind of advocacy, that's important for the mental health of students,
Absolutely.
parents, and even teachers who
Mhm.
really would just benefit from some more targeted education and from even, dare I say it, being trained to identify their biases.
Mhm.
Yeah. Victoria, I get excited and I just go on and on and on and on and on. I could just keep talking about this because it is so exciting. So
It's real
Right.
though. Very real.
It is real. It is real. What else do we need to know about the reset experience? Where again, the cultural and clinical decision making reset. What do we need to know?
We've talked about the nominations that are open from now. So they're open now and they close June 30th. So make sure you get your nominations in. There'll be a link, Dr. Collins, right in the bottom of this
Yes.
for
Yeah,
you.
I'll put a
Yeah.
link at the end of the
Yes. Yes.
podcast today. Yes. And I'll also
Yes.
put the link for registering. When registrations open, they're going to open very, very soon. When registrations open, you will already have the link or the QR code so that you can register. Now, Victoria, let me ask you this. How much do you think this is worth? How much should we be charging before I tell them how much we are charging?
So given that we have a pretty decent lineup, 15 CEs,
Mm-hmm.
and then five, you could, if you need your ethics, you can get up to 5 hours.
Mm-hmm.
Let's see.
So,
I
um,
actually, I'm gonna say this so maybe people can understand me when I go here. I'm about to pay for an EMDR refresher course. I'm not getting any hours for it, but I'm about to pay for it, and I'm about to pay $200. So, given that we're getting all of this, I
the two
probably,
hundred dollars is for how much time? The
I think,
EMDR
I
refresher.
think the refresher is around 3 hours, 3, 4 hours.
3 hours. Oh,
Hmm.
okay. So 3 hours compared to our 15.
Yes,
That's
yes.
oh,
Dr. Collins, I think that maybe the reset should be priced maybe around 500 early bird.
early bird 500. Okay. And
With
then
everything that you can get, you
with
know?
everything that you're getting, early bird could easily be 500 over 3 days, huh? And
Yeah.
then the regular could be like what, 600 or
Yeah.
something
Yeah, yeah,
easily.
yeah. Yeah.
Do you know? Sit down, everybody. I This event, the early bird registration is $175 for 3 days.
Wow, that's a steal.
Yeah. And that's for the regular registration rate. If you want to get the VIP experience, where you get some extra perks, when you see the link, you'll be able to choose regular or VIP. Um, the VIP the VIP early registration is not much more than that. It's phenomenal. The whole package. Of course, if you register later, you pay a little bit more, but $175 for four, five of the most well-respected names in counseling nationally. Like, what? And
Probably
and
that's
then to
that's
hear
a
not
couple
just,
clients. That's a couple
yeah,
clients that you wish you could be able to get these hours. Please. Let's think
that's
about
it.
it.
That's
putting the
it.
budget.
Two
Yes.
clients, probably, right? And
Yes.
then to also hear from not just the established voices, but the emerging voices in the field of mental health training. Wow. Yeah. So uh, that early bird discount, you have to get in on that soon because that doesn't last real long. But we want you to hop on in there when you can. The registration again will be open in the next couple of days. But save the date for sure.
Yeah. And
Save
Dr.
the
Collins,
date.
I do have to say that you making this so affordable for counselors. I know that a lot of people talk about how, things are expensive nowadays and our profession, no one gets in it for the money. So I think the fact that you are not trying to charge
Yeah.
500 and for per therapist that enters is a reflection of you and
Well,
how much you care about this information getting out there.
I know the reality is that there are a lot of people that if I said $500, they would say, oh, well, I'm going to have to miss it.
Hmm.
And I don't want that. We all need it. We
And
all need it.
I think you said it perfectly. We do not want anybody to miss this.
We
We
don't.
don't. We do
We
not want
don't.
anybody to miss this.
Said it before, counselors, social workers, psychologists, psychiatrists, behavioral health assistants, educators, pastors, church leaders, anybody in a helping profession. You need a reset. And even
Mhm.
if you don't need continuing education, you need education.
Absolutely. A
So,
little education never hurt. Absolutely.
yeah. Thank you for helping me talk about this today, Victoria. Thank you
Thank you
for
for
your
having me.
hard work on the committee. And
Looking forward to it.
yeah, oh, we are excited. Listen, what we're called to do is not easy, but I just encourage you if you're in this field, and even if you're not in this field, you still need to take some time to reset just because it's how the world is right now. We
Mhm.
all need time to reset, but I recognize that my brothers and sisters, my colleagues in this field need a space where when they get their continuing education, it's usable and it's relevant both personally and professionally to help us stay in this game, stay in the game, stay in the race. And if you feel like you absolutely can't stay in this game, take some time off. Take a sabbatical. Take some time for your own mental health and your own strengthening and renewal and restoration because you matter. You
Absolutely.
matter. You
Mhm.
matter. I know I know what burnout looks like. And we don't need our counselors burning out. We need you healthy. We need you whole. We need you in the game for as long as you're supposed to be in that counseling space.
Mhm.
So that's
Mhm.
all we have for today. Again, thank you, Victoria, for
You, Dr. Collins.
sharing uh, sharing the excitement. You help keep me on track because when I get excited, I can go all over the place. So
No problem.
we are over the moon excited about this. It's again August 20th, 21st, 22nd. Until next time, keep practicing with empathy, humility, and a multicultural mindset. We'll see you next time.